Hi, you're on Dr. Lynn O'Connor's Facebook page, and my name is Catherine Janasek, and I want to introduce you to your favorite doctor, Dr. Lynn O'Connor.
Hello.
She just had a full day of colonoscopies today, but I wanted her to come on her Facebook page today and ask or answer some questions that you may have had this summer and may not have wanted to ask questions. Like maybe you have a doctor and maybe there are some questions that you have that you're a little too embarrassed to ask. And I want you to feel and know that Dr. Lynn O'Connor's Facebook page, don't be too embarrassed to ask these questions. We're going to do these Facebook Lives more often, and she is here to answer your questions. So if you have any questions right now and you happen to catch this live, go ahead and post them, and she is going to answer your questions live. But specifically today, Doctor, we're going to talk about during the summer, especially women tend to have issues with constipation, with their gut, because let me, paint the picture so people at home can remember what they're going through right now. The kids are out of school. They might be going on vacations, trips that they normally don't go on. They have, they eat things that they normally don't. Is that basically what's going on during the summer, Doctor?
Absolutely. During the summer, we are so off of our normal routine, and it's fun. We're at barbecues, beaches, picnics. We're grabbing chips. We're having burgers. We're eating fries. We're on the road. We're not cooking like we normally do, and we're definitely not hydrating like we normally do. It's very hot. You're out. You're playing. You're not close to your refrigerator or the home. So we grab sodas, we grab fruit punches. People are having beer and wine at cookouts and picnics. So we're not hydrating and we're not eating the way that we normally do on our regular diet, our regular day.
Great. And I just want to point out there's about, we have several people watching this live, so that's great. And thank you very much for watching. If you have a question, you are more than welcome to post it live right now in the comments, because Dr. O'Connor is here and she is live. You're watching this live and she will answer them for you. So we're talking about summertime. Your stomach might not feel good. You might not be going to the bathroom as often as you normally do. All right. So doctor, is it just water? Like what can people do to make themselves feel better this summer?
Well, the first thing is try to stick to your routine. If you eat at a certain time during the day and evening, stick to that routine. Make sure that you're getting enough fluids. If you're out at the beach, pack enough water. If you're out in the backyard, take a water break. Make sure the kids and yourself stay hydrated. If you're traveling and you're stopping at the rest stop, try to opt for foods that are a little less fattening and a little more healthier. I know we get the burgers, we get the fries, but if there's a sandwich, if there's a salad, and better yet, if you take the time, you can even pack foods to travel so you have healthier options. You can pack sandwiches, you can pack fruits, you can pack vegetables, make sure there's enough water on board, and that's really going to make a big difference. The other thing that's going to be important is sticking to your bathroom routine. Sometimes when we're at relatives' houses or we're on the road or we're in a hotel, we don't feel comfortable moving our bowels and going to the bathroom in a foreign place. But if you can stick to your bathroom routine, that's going to help as well.
Okay, that's a great tip. So making sure you take time for yourself, especially when you're a mom or your dad, you're a busy person, that morning routine that you have at home is really important for you to do at the hotel room, at your mother-in-law's house. You need to take that time or you're going to regret it when it comes 4 or 5 in the afternoon and you guys want to go on the boat or whatever, and you don't feel good and you just want to take a nap. So
exactly. And one other tip that you can do is get up a little bit earlier than everybody else. So you can have that privacy and you can have that private time. So and you're scared someone's going to hear you, you feel uncomfortable. Just give yourself a little extra time to do what you need to do and have a little extra privacy.
What a great idea. All right. So what are some other issues that you see from men and women specifically during the summertime? Are there any other health issues that you're seeing at your practice?
Oh, definitely. And people they're going on vacation, and depending upon where you are, I have people coming back with traveler's diarrhea from, foreign countries. It's important to heed the warning there. If you're not supposed to drink the water, don't drink the water. Bottled water is going to be key, and that's going to be very important. If you do find that you're having some GI upset, diarrhea, discomfort, just make sure that you call your primary care physician or just come in and have and be seen, because it's important. Um, those are a lot of the things that people are coming in with. They're dehydrated, they're constipated, and then when they have constipation, you start dealing with problems such as fissures and hemorrhoids and rectal bleeding. So an ounce of prevention is clearly important in situations like this.
Can you address? I hear this more from men than women, but men. Some people will say, "Well, I drink a lot of beer in the summer. I'm fine. I'm gonna, I'll say like, well, make sure you're drinking a lot of water at the, at the Cubs game or whatever." And someone will say like, I just drink beer. So tell men, how important it is to drink water, and beer is not water.
Well, yeah, exactly. That's the other water. It's really, really important for that, because, you're going to be at a baseball game, or you're going to be out at a barbecue. And of course, you want to have drinks with your family and drinks with your friends. And it's fine as long as it's done in moderation. But what people don't understand is alcohol is a diuretic, which means it makes you pee out the water that your colon would need to absorb so you can have softer stools and not be constipated. So if you are going to have a glass of wine, have one or two glasses of water in between. That'll stop the feelings of a hangover later on with the cotton, dry mouth, and the dehydration, and you'll feel a little bit more comfortable. Also, when we're out in the sun and we're playing and enjoying ourselves, we tend to reach for the wrong beverages to rehydrate ourselves. And the alcohol is clearly not the beverage to rehydrate with. So that's one of the things that's really important that people get to understand that. I've seen a lot of people too fainting, coming in nauseous, dehydrated, because they're out in the sun and they're drinking alcohol and they're not drinking enough water. Even if you can have a Gatorade or some type of electrolyte solution, that's going to be really important to make sure you take in, and to take in enough, because if you're thirsty, your body's already behind the 8 ball in the amount of water that you're going to need to have.
Okay, that's great. And actually, I think I would love to talk more about this in next week's, when we do this again next week, because I think it's a great reminder as July progresses and we go into August and it gets even hotter. Especially here in the United States, it just gets hotter and hotter in August. So I want to go back to where you talked about traveling in foreign countries. This may be just the women I know, but will you talk about, how bad is it when you get a little bit of like Montezuma's revenge? Like I've known women to go, I'm just going to drink a little bit of the water because it'll make me feel better, because things will come out, I'll get a little diarrhea and it'll be great. Now, what can actually happen, besides a little bit of traveler's diarrhea? What can hurt you when it comes to drinking water in foreign countries where they say don't drink the water?
Oh, well, clearly, I mean, there are certain, depending upon where you are, there's microbes and bacteria that are in the water that can have a significant amount of side effects. But one of the most common ones is that diarrhea. And and it's the kind of diarrhea that's secretory, where you're continually going to the bathroom, it's loose, it's watery, and then the patient becomes dehydrated. And it's at that point where they can't keep up with their water intake. It's coming out faster than they're able to put it in, and they're losing electrolytes that can become extremely dangerous. Most patients and most people usually heed that warning to not drink the water. And also you got to be careful too, because you have to look at where the ice is made from too, because you have a cool drink and then it's a hot drink. You want to make it cool and you put the ice in. So those are the things that are going to be really important to look at. And I think for the most part, it's usually the food sometimes that people are having prepared as well too. And that's something that a lot of people don't seem to think about, either in this country or out of the country, if you're eating foods that are not kept on ice, such as the potato salad, such as the egg salad. There are foods that you're going to have foodborne illnesses if you're not properly refrigerating properly cooling the beverages, the food that you're eating.
Okay, so that does, I was going to ask about that because
Yeah.
Year after year, we talk about making sure that you're not having a potato salad sitting outside, at your family reunion at the park. Try not to make things or bring things to the family reunion outside that's going to have mayonnaise. Are there any other trigger foods that could really cause you some issues this summer?
Well, usually it's the egg salads and the potato salads that are causing, because and the meats too. You can't have the burgers sitting out and the hot dogs sitting out for quite some time. Consume them when they're cooked, and if they're not going to be eaten, then they need to be refrigerated. That's really the rule of thumb there. And the other thing people don't do is they don't cook their meat quick enough. If you've got a large party, thorough enough. If you've got a large party, and you want to get those burgers and hot dogs out to folks, they may not be cooking them to the temperature that they need to. So it's important to have a cooking thermometer right next to you and to test the temperature of your meat.
Okay, that's great. And then is there anything else that you're seeing right now? I know that you specifically focus on trying to help people when it comes to preventative health, making sure that in general, not just in the summertime, that you're trying to help people, when it comes to fighting obesity, et cetera. In the summer, it can be really hot. What are you personally doing to keep exercising and keeping with your routine this summer? What are you doing?
The summer is absolutely wonderful because that's where people are getting out, they're hiking, they're shedding all those horrible winter clothes, and they're swimming, and they're doing a lot of outdoor activities. It's important that if you are in a heat wave, which it seems like New York City's in right now, where it's like 95 degrees, or at least it feels like it, to make sure that you try to work out during the morning hours or late evening when it's a little bit cooler. Gym, if you don't have a gym membership, that's going to be very key to make sure that you stay hydrated when you're out there. I do a variety of exercises. I run, I do yoga, I swim, I'm on the treadmill, I do weight classes, and it's important to have a variety so you don't get tired of your workout routine, and also to mix in actual weight training as well as cardio, because you want to build that strength and that stamina. And muscle obviously burns more calories than fat. So that's a lot of options that you can do.
That's great. Now, for those of you who are watching, I just want to make sure that you know that you're on Dr. Lynn O'Connor's Facebook page, and this is live right now. We are going live. Doctor had colonoscopies all day, and she was very nice enough to give me a little bit of time because I wanted to have her answer your questions that you might have been a little too nervous to ask your own doctor, or maybe you haven't been in yet to see Dr. O'Connor or haven't seen her lately. But I want you to know that we're going to do this more often, maybe even once a week. And so please feel free, doctor. We're just going to have them post their questions underneath this live, and then we'll either answer them during the week or I'll ask you them again when we're live next week. Does that sound good?
That sounds absolutely wonderful. And as always, it's important when you think about prevention to make sure you're getting your screening colonoscopies to prevent cancer. I always make sure, no matter where I'm speaking, no matter what I'm doing, that message gets across clearly. Now's the summer. If you've been putting it off during the year, you have a little bit of time. Come in. We'll sit down. We'll talk. We'll do the consultation, and we'll get you scheduled for that colonoscopy as well, too.
Excellent. Can you remind us all at what age for a woman to start having colonoscopies?
Well, in general, if there is no family history, if you have no symptoms, the average age is 50. And if you're African American or minority persuasion, we're looking to do 45, because if you remember, stage for stage, when colon cancers are diagnosed in African Americans and minorities, they are far greater stage than they are in the Caucasian counterpart. So we start screening at age 45.
Okay, so 45 for people who are minorities, whether they're men or women.
Absolutely, yes. Definitely, because the African American race clearly needs to be in there at age 45.
Okay. And you have talked about this before. I know that you were on NBC in New York, and you talked about just the there might be more cases of colon cancer when it comes to African American men and women because of lack of education and maybe some family. They don't want to talk about it, ask questions. Talk about more about why minority groups may have those cases that are higher than people who are white.
Yeah, not necessarily actually more. It's what's happening is it's more that when it's diagnosed further advanced stage. And we're not necessarily exactly sure why, but some of the factors that are thought about for exactly disparities in healthcare, disparities in access to healthcare, socioeconomic status, education about the importance of screening, lifestyle factors such as obesity, alcohol intake, smoking, sedentary lifestyle. All of those factors can play a significant role in the development of colon cancer. And
Okay.
that's something that is a problem, yes.
All right. And of course, if you have any family history, to go in earlier than 45, for sure.
Yeah. Any family cancer in a first degree relative, you should be in there at least 10 years before that person was diagnosed. For instance, if your mother or father or sibling had colon cancer and they're 45, you should start screening at 35. But if you have any symptoms such as bleeding, pain, change in bowel habits, weight loss, you just come in and get evaluated.
Okay, great. Don't be afraid. The doctor sees this kind of stuff all the time. I'm sure your case is not the worst she's ever seen. Make sure to give Dr. O'Connor a call and make an appointment with her. She sees men and women, and she is in the New York area, and she works within the tri-state area, I would say. And if you're in the tri-state, give her a call.
Yeah, I'm in Long Island, New York. I have offices in Huntington and offices in Lake Success, and I have patients come from as far as California, Pennsylvania. I see New York, New Jersey, Connecticut, and the entire 5 boroughs. So if you need me, I'm there.
Perfect. Okay, and then we need you, so you'll be here back on Facebook Live next week, and I will make sure, if you're watching this right now or if you watch this in a recording, I will make sure that we get this posted so you can see it and you can share it with family members. Please do that. This could be very helpful, and that we'll make sure to post when she's going to be live again next week to give even more information for you to keep you healthy and make sure you can try to prevent cancer if you're, whatever you can, prevent it.
Absolutely. Absolutely.
Great. Well, have a great day,
Kathy.
Doctor. Thanks for the time.
You got it. Thank you. Bye.
All right. See you next week. Bye.